Hello, my name is Danielle Petsis, and I am a member of the Speranza Human Compassion Project team. I'm currently a senior at the University of Pennsylvania studying health and societies, and today I will be talking about the emotional attachments between victims and abusers. So throughout the presentation, I will often refer to relationships between a man and a woman, but these situations are not exclusive to heterosexual relationships. So firstly, I will talk through the problem that is present. I will then discuss the 4 types of emotional attachment as described by Bartholomew and Horowitz. After this, I will discuss the 2 different theories on why women become emotionally attached to their abuser. I will then address the role of the first responder, followed by the action steps that should be taken. So, when women who are abused often face difficult decisions regarding their abusive environments when there are emotional attachments involved to their abuser. They often have long histories of love and or happiness with their husbands, which makes it hard for them to weigh options and whether or not to leave their home because it is dangerous or whether to stay because they have this and sometimes loving relationship. So Bartholomew and Horowitz describe 4 different types of attachment. Secure attachment, which is described as comfort and intimacy with their abuser. Preoccupied attachment, which is described as when a woman has a preoccupation with her relationship with her abusive husband. Fearful attachment, which is when a woman has a fear of intimacy or social avoidance, which is similar to a feeling of anxiety. Dismissive attachment, which is when a woman will dismiss intimacy and engage in counterdependence, which is the complete refusal of needs and desires of themselves. So in the next slide, I will explain how these types of attachment occur with negative and positive models of self and negative and positive models of their partner. So in their model, Bartholomew and Horowitz describe the model of self, which is also correlated with the dependence of the self. And then they also describe the model of the other, which is the avoidance of the other for the victim in the relationship. So, with a positive model of self, there is a low level of dependence in the partner. And with a negative model of the self, there is a high dependence in the partner. And with the model of the other, when the model of the other is positive, there is low avoidance. And when the model of the other is negative, there's high avoidance in the partner. So, when the model of the self is positive and the model of the other is also positive, there is a secure attachment. When the model of the self is negative and the model of the other is positive, there is a preoccupied attachment. When the model of the self is positive and the model of the other is negative, there is a dismissive attachment. When the model of the self is negative and the model of the other is negative, there is a fearful attachment. So now I will discuss one of the theories as to why women stay with their abusers and why these emotional attachments develop. So in traumatic bonding theory, it is thought that in times of abuse, there are also times of positive behaviors that follow the abuse. This creates a strong emotional bond among battered women and their abusive spouses. Women often disregard the violent encounters once the abuser expresses sympathy and love for them. So there is often a forgetting of those times of abuse and focusing on the love and sympathy that their partner is showing them. Another theory by D.L. Graham is called societal Stockholm Syndrome theory. In her book, she describes the emotional attachments of women similarly to the relationship between capturers and captees. In kidnapping situations, the captees are often brainwashed to make them feel as though they belong with their captorer. They often believe that they are safe and belong with them because they become used to the structure. In violent relationships, the women become used to the structure and believe that this is the way that things are supposed to be in this male-dominated culture. Graham says that this theory can be applied to many different oppressor and oppressee relationships. So these theories should be taken forward to aid the role of the first responder. A first responder can be a physician, a social worker, a police officer, etc. So here are 3 different components of their roles. First, it is important that the first responder recognize the emotional attachments between victims and their abusers. If they are to understand these attachments, it will allow them to have a more successful experience with the victim. Second, it is essential that the responder recognize the victim's decisions are not always easy to make. If they are to understand these first 2 ideas, then the victim may be more willing to correspond with the first responder and make the situation easier amongst the responder and the victim. Lastly, it is important that the responder practice methods of motivational interviewing. This method of therapy is often used with those that struggle with substance abuse problems. I will go in depth into this theory in the next slide. So, motivational interviewing is a technique of therapy that focuses on creating an atmosphere of constructive conversation that allows women to open up about their emotions. It requires the first responder to be empathetic toward the victim in order for her to explain her emotions. In using this method, it is very important to listen and keep an open mind for the victim. So now there are 4 action steps that I've put together that are important to help with emotional attachments of victims. Firstly, to help these victims, the local government needs to provide support and funding to emergency shelters for abused women in its cities. It is evident from research that these shelters do not have the best support and are severely understaffed and underfunded. Quite often, they have good structural resources, i.e., aiding the woman in finding a place to live, helping to find her a job, etc. However, they're not very good at providing emotional resources. Without these emotional resources, oftentimes women find themselves going back to their abusive homes. If there are ways that we can provide more funding to hire a therapist or a psychiatrist in these places to provide emotional support, then we may have less cases of women going back to their abusive spouses. Okay, so secondly, therapists should be implementing methods of motivational interviewing. This would help more women become open about their emotions and their thoughts and their inner feelings. From research, it seems to be an effective method of helping women. So if we were to have more of this motivational interviewing going on in these domestic violence shelters, then we could have more success in women rejoining their abusive husbands and staying in a dangerous environment. Thirdly, the spread of knowledge about traumatic bonding and emotional attachments through advocacy groups is something that needs to be worked on. The spread of information will encourage women to become more self-aware of their own emotions and feelings and their situation, but will also bring awareness to others. That way, more first responders are aware of what the victim could be going through in these situations. Lastly, I would definitely recommend further research into domestic violence and the best interventions and therapies. While there is a lot of research into these relationships, no 2 are the same. With more women gaining the confidence to come forward about their experience, we could make resources and therapies a lot better for them. So I hope this presentation has proved useful and will be helpful in learning about the emotional ties between victims and abusers. So thank you for your time.